Good evening. Janine Cordew has an illness which cannot be cured. Thanks to the right medication, she has her illness under control and has been living for years without any health problems. Unfortunately, she is now experiencing unpleasant symptoms unnecessarily, including sleepless nights, nausea, difficulty in breathing. In her case, a change of medication would have very serious effects. However, she has no other option. Following the discovery of a serious contamination in a well-known and successful medication, it was taken off the market. According to the manufacturers, no serious incidents have so far been reported, apart from a few allergic reactions. As a result of the medicine recall, Janine can no longer take her usual medicine. She has been prescribed replacement medication which causes side effects such as sleeplessness, nausea, and difficulty in breathing. How could this have happened? We are discussing this with Jack Bourne, an inspector for the Health Service, and William Dorr, a spokesman for the pharmaceutical industry. Mr. Dorr, a contamination in a well-known and successful medication. This is surely bad publicity for the pharmaceutical industry.
Now, this is an extraordinary situation. It's rarely the case that a medicine represents a risk for a patient.
Rarely the case. This should never happen.
We invest a lot in training our personnel well. Internal checks. The employees follow GMP guidelines to the letter, which ensures good manufacturing practice, and in fact our checks rarely reveal anything untoward. When something is found, deliveries are stopped immediately.
The authorities carry out regular inspections, and still we repeatedly find irregularities. For example, cleaning may be carried out incorrectly. People tend to clean according to a routine, and this simply cannot happen in the pharmaceutical industry.
Mr. Dorr, this medicine contamination, how could this occur when, as you say, all pharmaceutical companies produce in accordance with GMP?
Despite our very best efforts, mistakes may sometimes occur.
Yes, but shouldn't this contamination have been discovered before the medicine was brought to the market?
In this case, it was an unknown contamination, and there was absolutely no indication that any mistakes had been made during production. Medications are manufactured and tested according to regulations. An unknown contamination can only be discovered by chance.
Manufacturers need to work more strictly to GMP guidelines. This could have prevented a contamination of this kind. A test alone is not sufficient.
Is there any way that Janine Cordew can still get her old medicine?
No, there aren't any old batches in pharmacies because the product was taken off the
The
market.
patient then pays the price.
It's not easy for the company either. A recall campaign is very expensive and bad for the company's reputation.
It's the patient who suffers as a result of these unsatisfactory working practices.